Dear friends, welcome to Know Thyself YouTube Channel. Good morning. Hope you're all staying safe and keeping well. I sincerely thank all of you who have subscribed to this channel and follow the channel. If you find the contents of the videos uploaded in this channel useful, please subscribe to this channel and click the notification or the bell icon so that you can be notified when a video is uploaded. Kindly share the videos with others or on the internet. In the last episode of Know Your Mind segment, we spoke about the causes, diagnosis and treatment of hearing disorders. In this episode, we begin our analysis of Central Auditory Processing Disorder or CAPD by spelling out its nature and characteristics. Before we can speak about Central Auditory Processing Disorder, we must understand what is central auditory processing, also known as auditory processing. Central auditory processing is the perceptual process of auditory information in the central auditory nervous system. It is a neurobiological activity that underlies that processing. It consists of mechanisms that preserve, refine, analyze, modify, organize, and interpret information from the auditory periphery. These mechanisms include auditory discrimination, auditory pattern recognition, temporal audition comprising of temporal integration, resolution, ordering, and masking, sound localization, and auditory performance. Central auditory processing disorder is also known as auditory processing disorder, language processing disorder, and auditory information processing disorder. It consists in brain area responsible for interpreting auditory signals, failing to process auditory information. As a result, the brain is unable to understand and interpret auditory information in a normal way. It is an impairment or deficit in the neural processing of auditory information in the central auditory nervous system, leading to deficiencies in recognition and interpretation of sounds by the brain. Hence, problems associated with CAPD are not due to an intellectual impairment or any peripheral hearing loss, which includes conductive hearing loss at the level of the outer or middle ear, sensorineural hearing loss at the level of cochlea or auditory nerve, or any other type of hearing loss due to problems of the ear. Some of the characteristics associated with central auditory processing disorder include a tendency to be easily distracted, difficulty in maintaining attention, academic difficulties including reading, writing, spelling, and other learning problems, difficulty determining and localizing the source of a sound or signal, difficulty following directions or auditory commands, difficulty following rapid speech, difficulty learning a foreign language or novel or technical speech materials, inability to detect change in rhythm, stress, and intonation in speech, difficulty understanding speech when there is competing background noise, frequent request to repeat or rephrase information, inconsistent or inappropriate responses to requests for information, difficulty learning songs or nursery rhymes, poor musical ability, and lack of skill in appreciation of music, taking longer time to respond in oral communication situation, misunderstanding messages, inability to interpret sarcasms or jokes, poor performance on speech, language, or psychoeducational tests in the areas of auditory related skills, having trouble telling the difference between two similar or distinct words, difficulty following long conversations, not able to remember or recall what people said, slow processing of thoughts, and needing longer response time, and inability to recall the order of sounds in a word. The above described characteristics indicate that central auditory processing disorder affects how a person analyzes and uses data in auditory signals. It affects four areas. First, auditory discrimination, inability to notice small differences between words. For example, the term 40 may be understood as four words, and the word couch may be understood as cow. Second, auditory figure ground discrimination, that is, being unable to pick up specific words in a noisy background. Third, auditory memory, being unable to recall what was said, like remembering phone numbers or song lyrics. And fourth, auditory sequencing, that is, difficulties in understanding and recalling the order of words. Thus, it can lead to difficulties in higher order language learning, including reading and writing and communicating with others. People who suffer from CAPD would find it difficult to understand what people are saying and communicate with them, even though they do not have a hearing problem. As a result, central auditory processing disorder can significantly impact a person affected by it at school, at work, in everyday communication with people, and social interaction with others. Hence, over time, the affected persons can develop anxiety and depression. In the next episode, we will talk about the causes, diagnosis, and treatment of central processing disorder. Thank you for watching this video. Stay blessed until we see you again with another video.